Today, we are going to discuss about a trip I made. You see, about a month ago, I had luxurious accommodations provided to me by what is known as an apothecary, or if you'd like, a hospital. Yes, they gave me a bed covered in that weird leathery rubbery thing that squeaked every time I turned. They gave me fluids not through my mouth but through my veins, and they proceeded to stick all manner of gadgets to measure my heart rate, my blood pressure, and other things. In other words, I found myself in what is called a high dependency unit. Now, I know the socialites among you think that this is a unit where you become a dependent of someone with money. No, this is a unit you become dependent on medical equipment to keep you alive. Wait, same thing, except the equipment for me is medical, the equipment for you is biological. Where you find it in your body is up to you. But high dependency unit. So this is not a story about how I almost died, or like how I tell my friends how I broke my own heart and it stopped for a minute. That's not the story. The story is this is 101 with Mark Bichachi, so it has to do with economics, politics, and the plans. So what is the economics and politics I'm talking about? Universal healthcare. Now, of course, being a survivor of HDU, I will tell you the trauma that you face when you are admitted in such a place. The trauma you face does not come when you come out of the fog of whatever thing that had clouded you, or whatever miasma you are in, or whatever disease you are suffering in. No, 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 no. It's not the headaches, the joint aches, and the pain that will shock you. What will shock you when you come out of HDU is the fact that it costs roughly, averagely, about 100,000 shillings a day. Yes, you heard me right. 100,000 Kenyan shillings. Yes. It costs about, to convert to dollars, about $700 a day. It's bloody expensive. And as I was looking at my bill, wondering how, in God's name, someone is supposed to survive in this country if that's the price of staying alive, I wondered to myself, how then does a poor person have a chance in hell, heaven, earth, or under the sea to survive if they're in emergency? Truth is, they can't. Why can't they? Because there are certain aspects of our constitution that have not been implemented, especially when it comes around to healthcare. Why? The constitution guarantees that every person has the right to access emergency care, which means if you're in an accident, you faint, you pass out, you are poisoned, whatever is urgent, you should be able to walk into any hospital and you should receive the services necessary to resuscitate you and stabilize you, which means they do the first aid, get you within the realm of normalcy, and then stabilize you so that if that hospital is too expensive for you, they can transfer you or whatever. But I can tell you, if today you walk into a hospital and your leg is hanging at a 90-degree angle, not backwards, but frontwards like this, you will not receive aid unless you have an insurance card, or you have cash, or you have a guarantor who's willing to pay your bill. Okay? So that means that the issue of universal health care is not an issue that we can play around with. It's literally an issue of life and death. Now, when you move beyond emergency care, we know the stories of people who finished their stay in hospital, they can't afford to pay the bill, and the hospital has become a prison for them. Now, I'm not sure whether Kenya has rules, and let me ask Wakili, does Kenya, in the States, for example, you can arrest someone, If they came into your shop and didn't pay in full, you can detain them as you wait for the police. Can you do that in Kenya? Okay, so the hospitals, citizens arrest. So you are allowed, if you go to a shop and you don't pay, the shopkeeper can, or the hotel can keep you until you pay. As long as they call the police. You see, so we know many people whose relatives, corpses, where corpses and people have been held in lieu of payment, waiting for people to pay. So of course this is an issue. Now hold on. There have been rulings, especially given to hospitals, that they cannot detain people because they have not paid their bills. But the hospitals are pushed back and said, so how do we guarantee that our bills will be paid? Hospitals are not banks. They are not insured against non-payment of services. So it's a big issue. But for many Kenyans, treatment and seeking hospitalization has to be an emergency like mine, where you're literally in the throes of death, or has to be such a serious condition that you actually need to see a doctor. And even if it is serious, you will sit at home and decide, hii headache ni ya malaria. Hii stomachache nahitaji tu kuchukua inaitwangaje, charcoal, activated charcoal, Eno and Actol and all of these things. Why? The reason why Kenyans do that is not because they do not want to see a doctor. Some of you, I know you don't. Some of you hear a doctor and you get even sicker because you have phobias. Different story. But for most of us, it is just the thought that you go and you see a doctor, you just look at them in the eye, and then suddenly you've got 5,000 shillings consultation on your bill. That's the issue. You see, when I was in HDU, I was quite surprised to see that a doctor who came next to my bed, I did not ask for them to come, they showed up next to my bed, said hi, asked me how was I doing. I told them how I was doing, and they walked away without telling me anything, and they billed me the princely sum of 10,000 shillings. That's the most expensive good morning I have ever had to face. The nearest, most expensive good morning, by the way, in case you're wondering, is when I said hi on Instagram to a socialite, and then I instantly owed her money. Tongue in cheek. So, there's definitely an issue with healthcare. So, universal healthcare is only one of two pillars of the big four that have managed to transition into the bottom-up economic transformational agenda, otherwise called BETA. Now, why is this important? It is important because healthcare is one of those things that can ruin you financially in under a month. The HDU bill per day is 100,000. So how many of us can survive in HDU for a month? Because that's 3 million shillings. That's if they don't need to do dialysis, they don't need to do surgery, they don't need to do anything serious on you. In a month, you are in 3 million shillings, if not more, that you need to pay. Your insurance, your fancy one, from Jubilee, Siju Amakos, whoever, will not save you, because most of us, insurance ends at 2 million. So you are immediately in 1 million shillings debt. God forbid you catch cancer. If you catch cancer, then you and your relatives are about to file for bankruptcy. That's a reality. So healthcare is not just about health, it's also about finance, and it's also about whether your family that has just escaped poverty because your grandfather was poor just 50 years ago, and you are the first generation to make it, you're living in a 3-bedroom house in Kilimani. Congratulations, by the way. You've just made it. If you fall sick, you will unmake it very fast. So the government has 3 pillars that I want to talk about. They are critical. The first pillar is emergency and chronic disease cover. This is so important. Because if you have an emergency, the only way the government can enact the right for emergency care is if the government is the one that guarantees hospitals to pay them in the event that they treat a Kenyan during an emergency. This is critical. So that now, when people have accidents, we are not driving across town looking for the cheapest hospital. And you know we do this. Someone has an accident next to a 5-star hospital, and you know we've got 5-star hospitals. Those are the ones presidents go to. And then there's the one you go mtaani. Yes. So next to a 5-star hospital, you are literally outside the door, but no, you can't afford to go there. So you, broken leg, ear hanging out, mouth askew, being transported across town so that you can go to a hospital that is called Saint something, because thank goodness for the Catholics, they are the only ones who give affordable healthcare in Kenya. So it's important. So what does the government want to do? It wants to ensure and regulate how hospitals deal with emergency care. Number 2, on that same thing, is that chronic disease management. What are chronic diseases? Let's start here. You've got diseases like cancer. The moment you have cancer, whether it is chemotherapy, radiotherapy, or surgery, you are talking about hundreds of thousands at the very least if you're lucky, but most of the time millions of shillings that you need to spend. If we do not create a fund to help people with cancer, we are in trouble. But cancer is the big one, but we've got other chronic diseases. Let's talk of one that I am intimately familiar with, for example, diabetes. I tell you for free, diabetes costs me on average per month about 10,000 shillings just to cope with it. Now you can imagine if it costs 10,000 shillings to cope with it to someone who does not have insurance and needs this medication and treatment for a long time, how are they going to sustain it? So we do need to create a system for chronic diseases. Right? It's very critical, because people with chronic diseases are really suffering in this country. They're suffering because it is a constant bill that you've got to pay, and if you don't pay, it's literally life and death. And if you want to know how serious this issue is, I will ask Oliver, our editor, to play a short clip for you of how people with diabetes in the United States of America land have to split their insulin because it is so expensive.
Well, a group of diabetics from Minnesota recently returned from a long road trip to Canada to buy cheaper insulin. With rising costs of the life-saving drug here in the U.S., about a dozen or so people boarded a bus and headed north.
Fox 9's Christina Palladino live in our newsroom. Christina, for many on this journey, this supply will get them through about the next few months, right?
That's right. You are allowed to purchase a 3-month supply for personal use in Canada without a prescription, and it's considerably less money than here in Minnesota. Families on the trip say they're having to choose between paying the mortgage or buying insulin to keep them alive.
Wait, let me Google for you real time how much insulin is in the United States of America land, the greatest country in the world. Right? Insulin cost in the US of A. So, the average price per insulin pen, right, is the cheapest I can see by Aspat. Cheapest I can see is $69. But Novolog is $367 per vial. Meaning, per insulin unit, these guys are paying about 70 shillings per injection, which means when you have your pen, it means this guy per day in the States is spending about 1,000 shillings. Do that math, right? People are dying. So before we get there as a country, we need help with chronic diseases, high blood pressure, diabetes, cancer, HIV, and all of those things need proper care. The other thing that the government is doing, which I think is brilliant, is talking about primary healthcare. What is primary healthcare? It's two parts. Number one, it's having community healthcare workers. People who make sure your kids are not just eating ugali every day and their stomachs are distended because they have kwashiorkor, that your kids are getting the vaccines they need. Essentially, the truth is that if we had our basic healthcare well, and we had, we had food that is well prepared, we made sure there are no mosquitoes in our environment, we dealt with how waste is managed, we dealt with where people live, a lot of the diseases would stop. There is proof of this. Remember 2020, when there was COVID, and you all stayed at home and you're all washing your hands and sanitizing so that gentlemen who came out of the bathroom were not shaking your hand when they did not shake properly. We remember diseases went down. It is not just men who are nasty. There was that chick in a lift, in Kenya, Nairobi, on the phone, like two nasty people on the phone, gets into a lift, pulls the panties down, decides to all over the lift while on phone. Fine, chick is nasty. Who's that other nasty on the other side of the phone who was not like, hey, what are you doing? Kenyans are nasty. Nasty. Yeah. Anyway.
Smelt her fingers.
Yes, and smelt her fingers. Not once, not twice. She was like, lasagna. Fishy behavior. Anyway. So you need community health workers. You need community health workers to ensure that nasty girl, right, does not spread whatever she's carrying, because that's got to be some sort of disease. It's a symptom, right? So that's important. Primary health care. And then the second line is making sure that the dispensaries and their, units where it doesn't need to be a doctor, it's a clinical officer or it's a nurse who's stationed at your local level, so that your headaches, your infected finger because you went for the wrong mani-pedi, can be handled at that level. Because the other issue is you don't want people bringing nail problems to Kenyatta Hospital or for KU referral. We need to have the proper structures towards, and by structures I mean that hospitals are structured that if you have a small issue, you go to your local dispensary and then escalate depending on what is needed, right? So a lot of us, and you've seen this, that if you go to hospital and you have an insurance card, instead of seeing a general, a GP, a general practitioner of medicine, you're immediately taken to a specialist. So it is not necessary that the first headache you have, you need to see a neurologist. No. Even a clinical officer is very much competent to tell you, please take Panadol. So if you're taking Panadol level headaches to a neurologist, it's good news for the neurologist. He's making more money, but you're also draining the resources for the person who actually needs to see a neurologist because they have MS or they have some other serious issue. So you and your non-epileptic self needs to take your headache to a nurse who can tell you, please take this, or a clinical officer, so that we are able to escalate problems. If your headache persists, then see a specialist. So we need to have that ranking correctly. But then, of course, universal healthcare has to answer the most critical of questions. The doctor's visits, the dental visit, the eye visit, all of those visits. Can a Kenyan not wear glasses that have stopped fixing their eyesight for the last 6 months and they're having terrible headaches because they can't afford to go see a doctor. You know, that's just the question. Can we actually go see a doctor for whatever issues we have, because it will not break our banks? That's just what we need to do as a country. We need to be at a point where a visit to the doctor may scare you because of injections, that's fine. Scare you because hospitals scare you, that's fine. But you should not be scared because the bill will bankrupt you. We need to live in a country where it's not every day on your WhatsApp there's cousin, uncle, friend to friend, co-worker, colleague who's asking for Harambee to pay for a medical bill. That's what needs to change. And that's one pillar me, my gang, my crew, plus you, I hope, supports in this bottom-up economic transformation agenda. Please transform our healthcare. Asante sana Bwana Rais. Cheers.